Good afternoon to all the participants. Good morning to all those being far west from the Greenwich Meridian, and good evening to all of you being far east from the Greenwich time zone. My sincere welcome to all participants to today's webinar on standards and accreditation for telemedicine and telehealth services in the international space. I hope you all agree that the webinar is recorded. My name is Drago Rudel, coming from Slovenia, and I'm co-chair of the International Society for Telehealth and e-health working group on standards and accreditation. I'm glad to see that there is a great interest among professionals for standards and accreditation in telehealth. Many of you have already expressed your interest to join our working group. Today we have 5 panelists and around 60 registered participants. I would like to propose to keep the webinar within 60 minutes time frame to preserve some time for discussion. Each presentation should not be longer than 15 minutes. I would be happy if the webinar will be interactive as much as possible, so panelists will have access to mic and video. So I expect their input into this webinar. I also encourage the other participants to interact via the chat function or question and answer window. We will keep an eye on questions or comments coming in, and we'll try to address them orally during the session or in writing in chat or question and answer window, or maybe even later by email. So the first panelist today is Dr. Osama Elhassan. He will make an introduction to the issue of this seminar. Dr. Elhassan serves as a health informatics specialist at Dubai Health Authority to develop the digital health regulatory framework of Dubai. He's also the head of the e-health section and is co-founder and the vice chair of the Emirates Health Informatics Society. Of course, Dr. Elhassan is active in the International Society. He is a board member. His presentation is entitled "The Need for Applicative Standards and Accreditation in the Medical Ecosystems." So, Dr. Elhassan, the floor is yours. Sorry, I'm afraid I don't hear you. Dr. Elhassan, could you switch on your mic, please?
Yeah, is it now? Yeah. Can you hear me now?
Yeah, yes, it's okay now. Okay. Thank you very much.
Okay, so I'll speak a little bit about ISfTeH. So ISfTeH is a 27-year-old global network of digital health stakeholders. It mainly include national telemedicine, e-health association, healthcare providers, policymakers, industry representatives, research and educators. So many groups are interacting under the umbrella of ISfTeH to advance the technologies around telehealth. So our vision as an organization is to facilitate the international dissemination of knowledge and experience in telemedicine and providing access to recognized experts in the field worldwide. And I think our webinar is part of this approach. What kind of mechanism we are using to disseminate telehealth and telemedicine knowledge is we have very active working groups representing many specialties in healthcare, as well as some hot topics in digital health in general. We use things like newsletters, conferences, webinars, technical services are also provided under the umbrella of ISfTeH. So in terms of a background, so as you know, many terms are coined for telehealth, and so we heard we usually hear terms around virtual care, telehealth, or telemedicine. They are actually addressing the same concept. So we are talking about services that really connect physicians and their patients when both of them, or at least one of them, is out of the context of a hospital. So all these technologies are actually addressed. So we're talking about even things like telemonitoring, telecare, we have many, many aspects of telehealth that we are addressing within our organization. So everyone knows that after the global pandemic was really a strong driver for an exponential growth for virtual and telemedicine healthcare delivery. However, currently speaking, we will think that telehealth now is poised to mature even more as time continues. So even after we know that mostly or the COVID is behind us mostly, but still now there's a lot of question about what will be the next, what will be the new normal. And now it's becoming very important to organizations to understand the current trends and the outcomes of the pandemics rather than just waiting and fall behind other providers. So now the huge demand which comes from regulators and also providers are because they are actually facing huge demand that is derived from consumers to show evidence of quality in telehealth. Also, the decision makers are looking for evidence-based roadmap on long-term funding models, clinicians, and patient acceptance, and legal and regulatory and technical barriers to achieve sustainable models of telemedicine. And because of that, thus, growing need now is coming for meaningful yet easy to implement international standards and accreditation that really optimize this and safe, efficient, and accessible patient care. So now we see that. And even if you can see here in this slide, this is a very recent survey coming from Gartner that shows that virtual care is on the top 3 digital innovations or digital investments that every care provider is doing around the globe. So still, virtual care is a hot topic. So from my view, what kind of aspects that accreditation and standards should address to help those providers to reach kind of a sustainable telemedicine strategy? So starting from down, so we're talking about technologies. These kind of standards, they need to address the infrastructure, security, privacy, and interoperability. And even when we're talking about the interoperability, we have to make sure that those telemedicine platforms are really engaged, really connected with, for example, electronic medical records, but in a very standardized way, not through, for example, a proprietary API. So these kind of elements that need really to be part of standards and accreditation. We're talking about the HR side, clinicians, training, how to do the project management of the programs of telehealth. We need new types of resources, new kind of roles to be part of the medical institute. And also we have technical and financial roles. So now we are talking about even new types of funding that needs also a special training. And talking from the process perspective, we need to customize workflows to make sure that we utilize telehealth in the right way. We need to update our regulations and our governance to make sure that these interactions are really validated from the evidence-based point of view. I'm talking about healthcare evidence point of view, making sure that we are addressing medical necessity and regulatory aspects. Knowledge management is very important. So even use cases we need to, that comes out of telehealth, knowledge that we receive through telehealth, we need to encode it in our systems and make sure that we can retrieve it as required. Patient engagement is a very important point that we need to address through KPIs, through continuous communication with patients to train them to even to make sure that they really make the most out of telehealth. From the business domain, so we need to even now to redesign our services to make sure that we are getting the most out of the telemedicine and telehealth and telemonitoring. Coordinated payment models. We need as a system, as a provider, to talk to our insurance partners, to our vendors, to our other partners to make sure that we really have a rewarding payment model that really incentivize doctors, incentivize patients to be part of the journey. We need also to look into our digital investments from the enterprise architecture point of view to make sure that we have the most cost-effective integration, the most effective architecture that really address all the needs of Last but not the least, we're talking about the actual outputs of the telehealth program, making sure that we achieve better care outcomes, we achieve better safety, and we really put forward some sort of really tangible ROIs in terms of service utilization and putting some efforts around value-based care through telehealth. So these the areas that any standards or accreditation programs has really to measure and to identify gaps around. We see in the market many providers of accreditation and standards. Some of them are actually very good partners of ISfTeH, and we still working with them and to give better offerings to vendors, to healthcare providers in terms of telehealth standards and accreditation. Before I leave, I just want to skim very quickly, in 1 or 2 minutes, about some of the efforts in our region that are paid by the regulators to help vendors and also vendors and healthcare providers to step into telehealth in a better way in terms of highlighting some sort of standards and I won't say accreditation, but mostly standards and regulatory processes before they launch their telehealth program. So, for example, in Dubai Health Authority, we've already established the standard for telehealth in 2018. Now we have the third version of it. It covers also both providers and telehealth platform providers. We've already now achieved 15 licenses for digital health providers. I'm talking with mobile apps or telehealth platforms. And we have many, I can say even hundreds of licenses for providers to make sure that they do or they commit telehealth in the right way. Within our processes of regulatory, we still recognize many well-known standards like ISO 13151 or ISO 27001 and HIPAA and GDPR are already part of our process. I can talk a little bit also about Saudi. Saudi is already witnessing a rapid development in many telehealth forms. So they created one of a kind model for virtual care hospitals, which is called Saha Virtual Hospital. And through it, there is a lot of utilization of telehealth technologies. And I think that's really a good experiment that everyone needs to look at. Also, they've embarked already with developing their own standards for telehealth under the umbrella of the Digital Health Standardization and Regulatory Framework, which is developed by the Digital Health Center of Excellence in Saudi in collaboration with Sibahi, NHIC, and Saudi Commission of Health Specialties. They've already started a framework that looks into areas like customer experience, workforce effectiveness, safety, risk management, clinical effectiveness, audit, and performance. The last use case that I think many of you already know it. So in Singapore, they started their journey in 2015, and lately they created a very ambitious program called the Licensing and Experimentation and Adaptation Program LEAP, which is considered as a regulatory sandbox, which allows the government regulatory body to work very closely with vendors to develop the right, I can say, regulatory processes for them. So I think this is also a very good experience that we need to look at. And that's it for me. And thank you very much. And we are looking forward for a good discussion today around telehealth accreditation and standardization. Thank you very much.
Thank you very much, Dr. Elhassan, for this very informative presentation. Well, I would propose to keep the questions until the end of all 5 presentations. So may I pass the word now to the second panelist, Professor Malcolm Fisk. Malcolm is a professor of aging and digital health at the School of Computer Science and Informatics, Montfort University, Leicester, UK. So he is an expert in telehealth services, standardization. He was also the lead author of an international standard named International Code of Practice for Telehealth Services. So his presentation for today is entitled, "What is new in the development of standards for telehealth and telemedicine?" Malcolm, it's your turn now.
Okay, thank you very much, Drago, and thank you, Osama, for a very useful introduction. Whoops, hang on, slideshow, there we go. There we go. Right, just for my introduction, and I think, by the way, that some of the things that I will say will complement what Osama has already said, but just to remind ourselves about what we want to get out of standards in this very rapidly changing...
Sorry, Malcolm, we don't see your presentation.
Oh, dear. Do you see it now?
Yes, we are ready now to listen to
your... Probably in the wrong mode. You're seeing the slides right down the left-hand column as well?
Could you go to the presentation mode?
Yeah, I think I'm on it now.
Yeah.
Do you see it now? No.
No, you should restart this
resume share.
Sharing. Yeah.
If it's
to select another presentation. So start slide projection and then reselect that window.
Indeed, I did. Can you therefore?
No, this is the same as it was. So maybe you just continue with in this mode. Yeah.
Right. Just to, I hope you see this now. Okay. Right. Just to remind ourselves about what our intentions are, what we want to get out of standards. Of course, they're important for trade, the accuracy and fairness in transactions, a growing challenge, if you like, because of the digital world that we're working within, and we can see standards as substituting or complementing legislation. And we obviously, because of the nature of our global digitalization and things like this, we do need to see standards in an international perspective. And that's not, by the way, to suggest that there's no role for more localized standards and variations and so forth, which I will mention in a moment. We do want, and already Osama has mentioned governance. I'm going to certainly talk about ethical approaches and recognizing that there is that ethical dimension that links health and broader well-being to some universal objectives I think we all share, including the United Nations Sustainability Development Goals. The dynamics are changing. Osama pointed to a virtual hospital initiative. I think that was in Saudi. And of course, a lot of healthcare support and so forth is taking place in the home and in the community rather than in institutions. So there are new ways of working with people and with service users, with patients, and whether they're in whatever context that happens to be, including in the public, private, and third sectors as well. And we have this huge challenge now. Data and data sharing, interoperability has already been mentioned, but we are learning very quickly, or we're having to learn very quickly about the challenge of artificial intelligence. And we need to think about how we fit AI into the standards that are being developed. And of course, there is some legislation, certainly in Europe, that is relating to that, GDPR, the new AI Act and things like this. So the parameters for that are beginning to be put in place. And I think we will see them more broadly than just Europe in the international context. So we also just need to be clear about who's deciding about these standards, how we involve people, patients and others in standards development to make sure that we are going to be able to maintain the trust, if you like, of patients and people who use telehealth services. And also, sometimes we need to move away a little bit from the domination of some of the big private sector players in the development of standards in order to find that kind of consensus that we want. And yes, and some of the legislative changes that are taking place will help us in this. very, very briefly, I've got here a list of, what is it, 8, beg your pardon, standards, recent standards. I'm sorry you have to look sideways to see these, but I'm going to focus just on 3 of them, just very, very briefly, to give us a flavour of what is there, and perhaps also then put their common areas and things like this. Now, this is a narrower range, by the way, of standards than the range that Osama pointed to. Osama pointed more to technical administrative things, but there's also an overlap with many of the things that I'm concerned about around governance, better care, and patient engagement as well, which are also in what Osama pointed to. Just with these 3 particular standards. Right, first of all, these are the PUC's personal user experience guidelines. By the way, I hate the jargon, PUX. And if we want to engage with and the support of ordinary people that use different standards and so forth, I think we want to get away from those kind of acronyms. I have come across PX as patient experience as well, which is something I think to be avoided. But the important thing about these guidelines is that they looked at the technologies in a way that was very, very concerned with their design and the way that people could access and use those different designs as well. And they looked for the ways, or the, how do I put it, the aspects of design, the characteristics of design that would be accepted in people's homes. So non-stigmatizing, responsive, simple and easy to use, human-friendly, all these kinds of things to try to avoid having the kind of machines you might find in hospitals transplanted into people's homes, as that telehealth agenda is applied or used in a whole wide range of contexts. And down at the bottom there, you'll see able to be personalized, not to have a one-size-fits-all, bearing in mind the variety, the huge variety of needs that people have. And also the issue of consent, which is an important one, and increasingly important in the context of AI and machine learning in particular, where it's not always going to be very easy to be clear how outcomes come about from the artificial intelligence, from the use of algorithms and the analytical processes that are taking place in that context. So some interesting guidelines there. I'll come back to that in a moment. We have got, as Drago mentioned, the International Code of Practice for Telehealth Services. The latest issue was 2018-19, and it did incorporate the ISO 13131, the 2014 version. Ideally, of course, that international standard should be updated to look at the changes that took place on 13131 for 2020. And this particular code, which emerged ultimately from the Telehealth Quality Group and previously to that from a European Commission funded project, does cover a range of management and operational issues around things like consent. It included tele and video consultations. It included issues about working with vulnerable users, and very much included a whole wide range of parameters that we would associate perhaps more with their care services. And it covered a whole range of domains from form monitoring to the use of apps and mHealth and so forth. And the framework was there for external accreditation and certification to be undertaken. Now then, this is just a signal of the particular domains covered by that particular code. And as you can see, it looks at some of the specific things, and it recognizes that service provision needs to be responsive to and able to accommodate a whole wide range of different contexts. Okay, right. Alan Taylor is with us today, and he will be talking a bit more about 13131, and he will no doubt correct me if I get anything wrong here from my interpretation of what's within that particular standard. Very important document, I think, because of the international reach, and I think levels of awareness of it are high. A strong focus on risks, quality, safety, and continuity of care. And there is actually a whole range of quality characteristics that have got a very strong ethical dimension attached to them as well. And it does embrace a whole range of different specialisms, as you can see on the right-hand side of the slide here, through from mHealth, telehealth, medical apps, telemonitoring, telediagnoses, virtual care, alarm systems, and you could probably go on, because a lot of these, of course, have got subspecialisms with regard to whether it's telepsychiatry or teledentistry, all sorts of things that I think can be captured within that particular range of characteristics, if you like. It does reference multiple other standards for personal health data, IT systems and things like that. And clearly, Osama and Alan would be more familiar with these than I am when it comes to things like SNOMED, HL7 and protocols and things like that, to make sure that technical interoperability takes place and to make sure that we're all thinking along the same lines when we define our services and configure our services. And there's multiple use cases. This is interesting and useful in this particular standard, which includes the primary and the secondary context. So again, recognizing that a lot of telehealth is happening in people's homes, in their communities, in their workplaces, if you like, or when people are traveling as well, rather than just the institutional hospital or clinical.
Malcolm, we have lost your voice. Not yet better. We still see you, but we can't hear you. No voice. Yeah. Okay.
Can you hear me now?
Yes, thank you.
Right, I will not put up the final few slides then, because really I'm kind of rounding off and summarizing here. So we have the three standards I just flagged. There are many others, of course, that are out there, some of which relate to particular niche areas. But I wanted to say, or ask the question, or answer the question, where do we go next? We have that variety of standards. I would suggest that probably the PUCS guidelines, the International Code, and the ISO 13131 are three ones that people will probably want to look at first. We'll hear more in a moment around the WHO ITU standard on accessibility and usability, which only came out last week. So, but nevertheless, clearly will, I'm sure, be of great interest to people who are looking at the broader picture and wanting to make sure that people, users, patients are able to access and use services in a positive kind of way. But there is further to go. The question I was asked about was really what the value was in the standards. Or indeed, what challenges each of the standards did have, or what were their strengths and what were their weaknesses. I think there's a fairly strong ethical foundation which goes across the board, which is good and important. But I think there's also the appreciation that standards need to recognize and respond to cultural differences, social differences, and so forth. We need to recognize that change in service ethos, which is more increasingly patient-people oriented, especially when we look at public health and preventative health issues, behavioral issues, lifestyle issues as well, as opposed to things that go on under the control of an institutional setting. And we need to ensure by doing that or making that shift that people's trust in services is maintained. And that part of that trust will be in the way that we apply artificial intelligence, the way that patients' data, people's data is protected and safeguarded, and the way that people can have some control over the way that their data are used. My final point is simply to say that that last point I think is a crucially important one, because the digital agenda is moving so fast, and we all have the need to respond as quickly as we can to the challenges and the opportunities that that presents us with. Thank you.
Thank you very much, Malcolm. We would like to proceed to the next presentation. Ms. Nea Samar-Brincic is chair of the working group on standards and accreditation within the National Society for Telehealth and eHealth. She also leads her private research institute in Ljubljana, Slovenia, specializing in end-user experience and telehealth telecare service evaluation. Her research presentation is entitled Available Resources for Accreditation of Telehealth and Telemedicine Services by Specific Standards. Naya, the floor is yours.
Thank you, Drago. Thank you so much for the introduction. And I'm glad that we had such valuable information by the speakers before me. I think I will just also have some information that is overlapping or that has the same issues that my preceders have pointed out. So I just very briefly, where we're coming from is the working group for standards and accreditation, and I share the vision and the mission of this working group with some very fine experts. So I'm very glad to be in such a good company. And just to say that everybody who is attending this webinar and also others who would be interested are very welcome to join us in our mission to have your valuable inputs for our work. And because we believe that that standards and accreditation improve the quality of patient-centric services everywhere. Also our vision is what Dr. Fisk has pointed out, the trust that we want to build through our activities, the trust for the services among people who are receiving the services, but also among clinicians, other professionals, practitioners, service users, everybody who is in the process. So I think we are on a good way to build this trust for our patients and everybody in the process. I will just very briefly introduce the available resources that we have. The standards have already been addressed, so the standards that are out there available, and we will share also our, hopefully we can share our presentations, because I would very much like to see the Dr. Fisk's presentation where we had to look like this, but I would like to study that a little bit more. So I'm looking forward to that presentation available for us. Yes, so the ISO standard has been mentioned and will be. Then the standards and guidelines that I have come across in telemedicine and telehealth that have been pointed out actually already in 2014. And some things that are built upon this by Elizabeth Krupinski and Jordana Bernard. Then development of standards came to my focus by American Telemedicine Association, and also in New Zealand, the regulations, standards and guidelines on the role of telehealth. Also the Dubai extensive standards and guidelines that we have thoroughly studied. I think this is a very, it's an excellent example how the governments, how the policymakers can approach this very obvious need that is out there for these standards, how they have adapted quickly to this need and to their developers, to their practitioners, and helping them with the standards. So I think that is a very nice and a very excellent example that Dr. Elhassan has presented, that is being developed in Dubai. So just alphabetically, I would like to say which resources are out there in a sense of accreditation. So it was quite interesting to, of course, those of us who are in this business that we are supposed to know what's going on, what is out there, which resources are available. We are in contact with the developers of programs for standardization and accreditation as well. We know these people, but if somebody just in general would go and search the websites, there are only a few accreditation organizations that are available. Let's say, if you look on the first 2 pages listed in Google, you can only find maybe 5 accreditation bodies. So that was kind of an interesting detail that came up during this research. So what are we doing if we are an organization that offers accreditation for telehealth and telemedicine? Of course, all this is very young. What can we do for the world to see that we have a program, that we have a good program, and that we can do our job? So, but anyway, so this was just a thought. So alphabetically, ISfTeH Telehealth Certification and Distinction. So the organization has 2 kinds of programs for certification and distinction, which according to my research, we could see that this is distinction would equal the accreditation process. Then already mentioned the accreditation of Canada. They have a telehealth rapid assessment available now, and they do the telehealth assessments and accreditation. And the Pharmacists Advancing Healthcare, or ASHP, which is available for telehealth in pharmacy. Then we have also a more specific telehealth for behavioral telemedicine or telehealth, So this is a behavioral health center of excellence, an international accrediting body created to meet the needs of specific to delivery of behavioral analysis. Then we have the National Committee for Quality Assurance. They have the program for telehealth. So the Quality and Accreditation Institute, the QAI from India, but working internationally. And the Joint Commission that has just issued the telehealth program. So they do an overall accreditation for telehealth. And also already mentioned the URAC. So URAC does all kinds of accreditations, but also specifically for telehealth. So this would be the available resources out there. And maybe I apologize if I forgot something. I would appreciate any information on the programs for accreditation for telehealth and telemedicine. What I could see through this research that the need is far greater than the resources at the moment. So I think that everybody who is developing programs for accreditation for telehealth and telemedicine, they will see that there is a lot more work out there than we can. So that the need is greater than what we can do about accreditation. So I would encourage organizations to put even more effort, to even more manpower, resources into developing programs for accreditation that will work according to certain standards that are service standards, and that would develop programs and have them available for organizations that would like to go through accreditation process. Not to exceed my time, but just a very briefly. So which standards are being used in accreditation process? This would be my question out there for us to think about this. And also I would appreciate some feedback about this as well. So which standards are being used most often? I know these are all very very young, very new questions. And as I was contacting various organizations also for pre-assessment process for assessment, I had a chance to be involved in the process, or my team and I, of assessing all of the telemedicine organizations or programs in Slovenia, including the National Institute of Public Health and Telecom of Slovenia, and private organizations, then the Medical University in Ljubljana. When we expressed that we would like to do this pre-assessment, we offered this, we talked about standards, and I could say that there is a certain uneasiness about this when you talk about standards, because these are all, as I said, new, and some of the services, or most of the services, were developed according to the need in the society. And at that time of development, they didn't have the resources like standards for telemedicine or telehealth or telemedicine. And they were uneasy about that, because we had to first reassure them that it is okay, because they could not develop according to standards which were not existing at the time of their development. But anyway, so again, the need is great, the need is growing, and in assuring the quality of service provision, we can come towards the organizations that would like to follow standards, that would like to develop according to standards for telehealth and telemedicine, and also providing them with the programs for accreditation. So these would be my thoughts, and I'm open for questions.
Thank you very much, Nea, for this overview. I would like to say that our working group has been working with some experts on additional webinars and other activities in the coming months to put even more focus on standards, certification processes, user experiences, and other aspects of standardization. So I would like to invite two additional panelists before we start the discussion. Both are experts in telehealth standards, to briefly present two standards that will be addressed in depth at our next webinars. So the first panelist is Dr. Alan Taylor, who is a member of the ISO working group 215, and he was the leader of the group that prepared the latest version of the ISO 13131 telehealth quality guidelines. So Dr. Taylor is also the Australian Telehealth Society committee member. And Dr. Taylor, please.
Thank you very much. I'll focus on just giving a bit of an outline of the international standard 13131. This standard is really intended as an umbrella standard, which is not a prescriptive standard, for the management of risk and the approach to risk assessment for services delivered using technology to other locations. As it is an umbrella standard, it's not intended necessarily to be used for specific services, hospitals, specialities, or particular communities of patients or clients. But it can provide the basis for those services and those groups to develop their own approach to managing services. And therefore, it gives examples of quality metrics that can be generated if you take a risk approach. So different countries, different services, whether it's in aged care or orthopedics, would have different standards and different guidelines that they consider are important to their type of service. So what we have seen internationally is many countries are starting to develop their own set of guidelines, which is great. Many specialities, particularly in Australia where I'm based, have developed their own set of guidelines for physiotherapy, for mental health, etc. And those communities, those organizations can draw on many of the standards that we've heard about today, including the international guidelines. Where we go internationally on guidelines will be interesting because I think it would be useful to have more implementation guidelines, in other words, how we actually implement and operate telehealth services and how we govern virtual care. I think that could be useful. It could also be useful to have a generic service management standard in this space. ISO already has some service management standards, but the overall aim of doing all of this work is to improve the quality and safety of healthcare and the trust of people, both clinicians, providers, and patients and clients, in the use of or provision of these type of services. So trust is very important. It's been mentioned by other panelists, and it's certainly something that I focused on in the book that I've written on Australian and Brazilian telehealth services. I'll put a link to that in the chat function. And I'd welcome other contributions on from other people about how we progress in this space. Thank you.
Thank you. Thanks to you, Dr. Taylor, for this brief introduction into the standard. May I ask the next panelist, Dr. Kaloyan Kameno of the World Health Organization, to present briefly the global standard for accessibility on telehealth services that has been prepared by the WHO.
Thank you very much, and thanks for this opportunity to present briefly the standard. As Dr. Fisk already mentioned a bit earlier, it was just launched actually a week ago. It is a joint standard between WHO and ITU on accessibility of telehealth services, and perhaps it's good to start with a bit of background why we decided to develop this standard. So especially at the very beginning of the COVID-19 pandemic, we did some rapid assessments in countries to check on the provision of services, and we saw that number one alternative strategy for continuing care, especially when there is disruption of the provision of physical services, is telehealth. And it doesn't apply only to high-income countries. It's actually more than 40% of low-income countries, they use in one form or another telehealth. But together with the increased use and provision of telehealth services, we also saw that it doesn't actually reach a large proportion of the population, many of those with disabilities. So many people with vision loss, hearing loss, with intellectual disabilities, with speech and language impairments, with mobility impairments, they experience very different challenges when accessing or using telehealth services. And we did a brief scoping review just to check whether any global standards or guidelines or guidance exist on how to make telehealth accessible. And we saw that in some countries like New Zealand, India, or the States, there is mentioning of accessibility in the national telehealth strategies. However, none of them were really comprehensive enough to cover all the different challenges that the wide really diversity of persons with disabilities experience. And that's why we joined forces with ITU, WHO bringing the health perspective and ITU the standardization perspective. And we developed this standard. We involved both civil society, so different organizations that work in the telehealth field, from the civil society, but also organizations of persons with disabilities, and also the industry in workshops to get their feedback and perspective. And we just launched this standard last week. It really targets those who are the implementers of telehealth services, so governments, health service providers, but also the manufacturers of telehealth platforms. And this standard provides a list of different technical requirements that telehealth platforms must have in order to ensure the accessible provision of telehealth services. And we do believe that if potentially implemented and adopted, it has the potential to support accessible and equitable service, telehealth services. And just to give a couple of examples, I will put in the chat a link to the published standard, but just to give a couple of examples of what type of requirements we have included. For example, we have divided it into sections according to the different types of impairments that people might have. So for those who have vision impairment or blindness, things like the fact that the functioning of the telehealth platform should be compatible with screen readers or braille keyboards, or that color contrast or screen magnification should be available to allow people to view images and text on screen during virtual visits. For those, for example, with who are deaf or hard of hearing, captioning, video conferencing should provide captioning, and also the option to have a chat box for people to send text messages. Also, for those, for example, with persons with speech difficulties, the platforms can include the, voice synthesizers, or, for example, text-to-speech generators. We have also similar requirements for mobility impairments, for mental health conditions. In mental health conditions is mostly around the text images that should not be disturbing, or the security around the use of telehealth platforms. We have also a section on those with intellectual disabilities, and for those with learning disabilities like dyslexia. So as I said, I will post in the chat a link to this standard. During the launch, actually, just to mention this lastly, during the launch, we had representatives from the government of Ireland and also India who expressed their interest in adopting this standard. We are already in contact with the person who is responsible for the national telehealth platform in India. They will launch an updated version in the next couple of months, and we will be supporting them to implement, at least at the initial stage, some of those requirements included in the standard. So yeah, I'll stop here, and if you have any questions, I'm happy to answer. Thanks.
Thanks also to you, Dr. Kameno, for the presentation of the standard. In the chat box, actually, we already have two links. The first was contributed by Alan and is pointing to the Australian, Brazilian telehealth services. So there is a reference to that. And the second contributed by Naya is the link to the code of practice for telehealth that was mentioned during our discussion. There is no question to discuss. But there is one question. Sorry, there is one question. I would forward it to Malcolm. It is about the availability of the progressive website. So, is the website which has been hacked or grabbed is available, or the database that was produced during the progressive project, is it available elsewhere?
Just quickly to respond to that, the website simply came to the end. It was not renewed because the project has ended and the funding was ended for that particular project. This is the progressive project concerned with ICT related standards for active and healthy aging. the directory of standards is surely with us. When I say us, the university, my university, and I will be there next week. So I will talk to my project manager to check what has happened to that particular directory, because it could well be that it may be a couple of years out of date, but it could provide a very useful resource.
Thank you very much, Malcolm. Well, I'm giving now the word to Frederick for his conclusion, so that we can end up within the time frame. Frederick?
Yeah, thank you very much, Drago, and thank you to all our panelists and contributors today. Well, let me start off by saying that this was let's say a more general webinar, an introduction, some background to a number of initiatives, a number of standards that are out there, but there is much more to be discussed and to be said on this topic. And so we are already looking into a deeper dive session and additional activities where, for instance, we will also have some of our ISfTeH members who are or who have already been accredited or certified, for instance, to the ISO 13131 standard organizations such as Apollo Telehealth in India, or also one of our corporate members, International SOS, have obtained that certification. So we'll be working with them together also with Alan Taylor to go more in depth on the assessments procedures that they have underwent and have undergone, and how this affects their service provision, how it assures quality, how it can increase the trust from users, which are important topics as we have heard today. But within our network of the International Society, we also have organizations like URAC and QAI, Quality and Accreditation Institute in India, URAC in the USA, which are members, and they also have accreditation programs, have been doing this as well for many years. We have already heard from them in some previous webinars, but we'll also be working with them and also their customers to provide a bit more background information and to show others, other telehealth service providers, what they have to look for, what is available, why it is important to look into accreditation and ultimately quality assurance of their services. We also heard guidelines being mentioned. So I think it's not only about making sure that let's say non-trustworthy solution providers would come onto the market, but also guiding those who are just looking for information as to how to set up their service, how to deliver their service. That's where standards, where accreditation programs can come into play. So continue to watch this space. If you're not yet a member in the International Society for Telemedicine, we encourage you to join, and then also to join the working group on standards and accreditation, which has been initiated by NEA and by Drago out of Slovenia, also with assistance from Malcolm. But the working group is open for other members and partners to join, and so it's basically just beginning, or is at its beginnings, and is looking for more input and collaboration with other organizations, with other people interested in or involved in standards and accreditation. So you will definitely hear more from us about upcoming activities, and we look forward to hearing from you what you are doing or what you are looking for and how we can assist you. So thank you very much to all panelists, all participants. We wish you a nice day and look forward to seeing you soon.
Thank you very much, Friedrich. In the chat box, there are some suggestions for new webinars, and also there is a question regarding how to join the technical committee on standards. So you will be informed about that, and you will be invited to further seminars that we will be pleased to organize, because due to such huge interest for standardization. Thank you also very much from my side, and wish you all the best. Goodbye.
Thank you.
Bye.
Thank you.
Bye.
Now, there's a work for you to answer the question how to join the technical committee from Vincent Michael.